Welcome to News West 9's West Texas View with Johnny Lou Avery.
Welcome to the West Texas View. I'm Johnny Lou Avery, and we started a series of programs several months ago, as a matter of fact, about the Texas Tech University Health Science Center and the goals that it has and how it impacts on the medical scene in the state of Texas and beyond, but also how all of the things that it does. And so I wanted to introduce to you again, we've asked Dr. Melinda Morris to come back. She's a board certified in obstetrics and gynecology, but she's also certified in clinical nutrition. And we're going to be talking a lot about areas that come under her expertise. But before we get into that, and I'm going to ask her to help me in just a minute, but I wanted to go back and refresh your memory about what the Texas Tech University Health Science Center is and what its goals are, because after we've had several of these programs, I've had some calls from people saying, I don't exactly understand. I didn't realize they had patient care, or I didn't realize they did research. So let me tell you that it was approved by the legislature in 1969, and it is a 6-campus school, actually 7 if you count Midland and Odessa as separate campuses. But they have the Permian Basin, Midland, Odessa. They also have the pharmacology and some other specialties at Amarillo. They have one at Dallas-Fort Worth. They have one at Highland Lakes. And then, of course, our 2 here. And then the headquarters is at Lubbock. Another person had called in and said, I didn't realize you had anything except at Lubbock. And so when Dr. Morris was speaking, for some reason it was confused that she was at Lubbock. But she's right here in the Permian Basin, teaches and has a private practice. So just for that little word of information, I wanted you to know it. But she works out of the Jenna Welch School Women's Center and has your office, and also do some of your research and teaching there. And so what else do you want to add about that, about what we need to know about the Texas Tech University Health Science Center?
Well, I think there is some confusion. People know about the Texas Tech University, and then there's the Texas Tech Medical School. And there's also the Texas Tech Pharmacy School. There's a school for physician's assistants. There's allied health. There's a nursing school. So Texas Tech does a huge amount of education in the medical field in the West Texas area. With the medical school, there are residency campuses in Lubbock, Amarillo, Odessa, Midland area. And so medical students and residents are getting training not only in Lubbock, but in Amarillo, Midland, and Odessa.
And that means they're getting training to begin to be a doctor, but they're also getting training in-service education, ongoing education after they become a professional.
Oh, that's right. Now, the process of getting your medical degree, is 4 years of medical school. And then once you've graduated from medical school and you have your medical degree, then you're going to decide what specialty you're going to go into. And that's when you choose your residency program, because residency is your training in your particular specialty. And depending on what specialty you choose, that determines how long your training is. For pediatrics, internal medicine, family medicine, they have 3 years of residency training. For obstetrics and gynecology, it's currently 4 years of training. For general surgery, it's 5 years of training. And then if you do additional training, a fellowship, that could be 1 or 2 years in addition to your residency. So learning medicine, training in medicine is a lifelong process. You never stop learning. And I don't think most people realize how much training and education is required.
And how expensive it is to first of all, equip an office, and also then to keep up with all of the new things. And we're going to be talking about some of the changes in women's health, and that's why we're so pleased to have you come back and visit with us. And as I told you, I have a whole string of questions, and I know that you had 2 or 3 other things you wanted to talk about. Primarily, you wanted to talk about preventive care,
yes.
and you also wanted to talk about weight management and how important it is to have a fit body, and then you don't have to come to the doctor as often as you ever want. But why don't you tell a little bit to get us started about why you chose to go into OBGYN?
Well, I always knew I wanted to be a doctor. My grandfather was a country doctor, so I guess I kind of inherited a little bit from the family. When I was 14 years old, I was a candy striper. I started working in the hospital at 14.
Volunteer.
When you remember those candy stripers and their little outfits.
Yes, yes.
But I just always felt at home with medicine and felt like that was my calling. That's what I was supposed to do. When you're going through medical school, you're really not sure what specialty a lot of times you're going to go into. And it's as you do the different rotations in medical school that you get exposed to the different specialties, and you get an idea of what personality do I fit with? What specialty, would give me the kind of lifestyle I'd want to have, take care of the types of patients I'd like to take care of. There's a lot of different issues that come into play when you're deciding which specialty you're going to go into. So you rotate through internal medicine, pediatrics, general surgery, psychiatry, obstetrics and gynecology, and during those rotations, you're getting a sense of what it's like to practice that specialty and if that's something you'd like to pursue. So when I was going through, it was like each specialty, if I did internal medicine, okay, I wanted to be an internal medicine doctor. If I did, surgery, okay, I wanted to be a general surgeon. But when I got to obstetrics and gynecology, I knew that was it for me.
You were sure then.
I was sure that was it for me. I love delivering babies. I always have. I've probably delivered over 5,000 babies, but every time you do a delivery, it's special. It doesn't matter how many you've done. So I love doing the deliveries. I love doing surgery. And so obstetrics and gynecology gave me an opportunity to also do surgery. And I like endocrinology, hormones, internal medicine, part of the practice as well. And you can do that with obstetrics and gynecology because you're practicing primary care for women. And so obstetrics and gynecology kind of gave me all the different areas that I was interested in.
Well, and that gives us kind of an overview, and we're going to take a break right now, but we're going to come back in just a minute, and then we're going to get into all of the things that we need to know about her. Dr. Melinda Morris, board certified in both obstetrics, gynecology, and clinical nutrition. So stay tuned for an interesting program.
Stay tuned. West Texas View will be right back.